So Priya's just indicating that most of our participants have joined us today. So just to start us off, just to say Croeso and good afternoon everybody. My name's Susan Miles and I'm the Director for Health Technology Wales. So thank you so much for joining us today for this event, Digital Solutions for Health and Social Care in Wales. And I should say this event has been co-produced by ourselves, Health Technology Wales, the Life Science Hub for Wales and Digital Health and Care Wales also, so it's a joint effort. We're delighted to welcome well over 100 participants who've registered for the event today. They're coming from various areas and parts, so from the NHS, from social care, from local authorities, as well as a large number of medtech companies, academic and third sector organisations. So it's really great to welcome such a diverse audience, and we very much encourage your engagement and questions both today and indeed after the event if you'd like to contact us direct. As you know, today's a National Day of Reflection, marking the second anniversary since the first national COVID-19 lockdown. And throughout the last 2 years, we've all become acutely aware of how important digital has become. We've all become much more digital literate and also aware of the huge potential that's offered by digital technology to transform both our daily lives, but also the care systems in which we all work and use. So we've a great programme this afternoon of really stellar speakers and an opportunity to begin to explore how Health Technology Wales, Life Science Hub Wales and Digital Health and Care Wales can collaborate to identify and assess the digital technologies that we think offer the most promise to deliver on care for the people of Wales. So just before we go into our programme, just a couple of brief housekeeping items. Our event today is being recorded for those who couldn't be with us who want to watch it later. So if you'd prefer not to be seen, then please turn your camera off now. As I mentioned, we have a large number of attendees today, so please do add any questions that you have in the chat bar, which we'll monitor, and we'll aim to draw out a few themes to discuss with our presenters. And to note, if we don't manage to get through all the questions that are raised today, we'll endeavour to do our best to follow up with a response after the event this afternoon. Okay, so to get us started, it's my pleasure to introduce Professor Peter Groves. Peter Groves is the Chair of Health Technology Wales, who will offer a welcome to the event on behalf of the three chairs of HW, Life Science Hub and Digital Health and Care Wales. Just a few words of background on Peter. So Peter is a consultant interventional cardiologist at the University Hospital of Wales. He's also Chair of the MHRA Devices Expert Advisory Committee and a previous Chair of the NICE Medical Technologies Advisory Committee for many years. He's a great interest in regulation and health technology of assessment of innovative medical devices in the context of the UK. Peter's committed to teaching and to research, and he's published extensively on the scientific basis for medical technology development and utilisation. So welcome, Peter, and thank you. Over to you. Thanks.
Susan, thank you very much for that kind introduction, and a very good afternoon to everybody, and a very warm welcome to our Digital Solutions for Health and Social Care event from me. I wonder, please, if we could move to the next slide. As Susan has already told us, this is very much a collaborative digital event, and my welcome extends to a number of colleagues, senior colleagues who've been involved in the planning of this event from our partner organisations. So I'd like to welcome you not just on behalf of Susan and myself, but also on behalf of colleagues from the Life Sciences Hub, particularly Carrie-Anne Quinn, Chief Executive Officer, and Chris Martin, Chair. Also welcome from colleagues at the Digital Health and Care Wales organisation. So a warm welcome from Helen Thomas, CEO, and Simon Jones, Chair. And at this stage, I really would like to thank all of our colleagues and their teams for not just the support they've given, but also to the practical help in planning this day and delivering this event this afternoon. So in my introductory comments this afternoon, what I'd like to do firstly is just to introduce you to our organisation, Health Technology Wales, to tell you a bit about what we do, what we're about, and how we work. I'd then like to move on to describe some of the thinking behind the strategic emphasis that we're placing just now and in the next year or so on assessing digital technologies, as well as then some of the hopes, some of the aspirations that we have, not just for the event this afternoon, but also for the work that we're embarking on in this space over coming months and years. So let me tell you a bit about Health Technology Wales. We're an organisation that was founded in 2017, following the publication in 2014 of the Access to Medical Technologies in Wales report by Welsh Government. So this report concluded that there was a need in Wales for an all-Wales medical technology appraisal system that provided a slightly more strategic approach to the commissioning of new medical technologies in Wales, which was driven by clinical and population need based on evidence, ensured equity of access for patients, and involved wide engagement with clinicians, with patients, with industry and research partners. So these were the founding principles behind the generation of our organisation. We have a wider remit though. We are also responsible for promoting the uptake in Wales of medical technology guidance from our partner organisation, NICE. And as part of that process and our own process, we oversee a formal audit mechanism by which we can assess the system response to the guidance produced both by HTW and NICE, and I'll talk a bit more about that later on. So next slide, please. So Health Technology Wales is funded by Welsh Government. Our governance is overseen by Velindre University NHS Trust. We have a physical base in the Life Sciences Hub Wales in Cardiff Bay. But as you can imagine, during the course of the pandemic over the last 2 years, a lot of our work predominantly has been virtual. Next slide, please. The vision of Health Technology Wales is to develop a world-class health technology assessment organisation, which facilitates the identification, the appraisal, but also the adoption of Health Technology Wales technologies that offer most promise to deliver improved health outcomes and value for the people of Wales. Our mission is to drive improvements in population health and care services by applying the best available evidence to inform decisions on the appropriate use of those health technologies in Wales. And next slide, please. There are some very important principles that are the basis on which we do our work at HTW. The first is evidence, and you'll have noted the presence of that word both in our mission and vision statements. Everything we do is evidence-based. Evidence initially from the published literature, but we have a slightly more permissive approach to the evidence we'll consider. So we will look at real world data, we'll consider patient experience, we'll consider unpublished evidence, we'll consider local audits as part of the round. All of our work is transparent and rigorous. So our decision-making meetings are held in public, and all of the evidence that's considered in those decisions is then published on our website. We are collaborative in the work that we do. So we work with clinical experts, we work with patient experts, we work with members of the public, and yet we are independent of those. We're independent of Welsh Government, and our decisions, our work is informed by stakeholders from across the wider and social care environment as well. So next slide, please. So over the last 4 years, since we've been in existence, our organisation has been directed by Dr. Susan Miles, who you've already met, and over the last 4 years, she has accumulated and appointed 28 professional individuals who are highly motivated, highly professional in their approach. These include health service researchers, health economists, information scientists, communicators, project managers, administrators. We have 3 core functions. Firstly, the important thing is to identify in the first instance those technologies which have promise, which have the potential to offer patient benefits and also system benefits, and on which there is sufficient research to be able to make recommendations. And then on those selected topics, we undertake formal health technology assessment and appraisal, culminating in the publication of national guidance on our website. But we also are here to promote adoption of the technologies on which we produce guidance, and also to audit the system response and the uptake of our guidance. Now, to help us with that work, we have 2 independent multidisciplinary groups. So we have an assessment group. This group comprises 11 multidisciplinary members and is chaired by Susan Miles. So this group is responsible for overseeing the selection of technologies on which we'll undertake appraisals, but also for overseeing the scientific rigour of the accumulation of the evidence that forms the basis of those assessments. I've just lost the slide on my screen, but it's back again. Thank you. We also have an appraisal panel. Now, the appraisal panel comprises 26 multidisciplinary members who represent a wide group of health and social care organisations from Wales. I chair that group, and the appraisal panel is the decision-making group for Health Technology Wales. And after considering the evidence, the appraisal panel formulates and agrees evidence guidance recommendations that are then published on our website. So next slide, please. Now, speaking as a clinician in a stretched NHS healthcare environment, working on the wards and bed occupancy rates in our hospitals feels a little bit like this, especially in the last couple of years or so. But these similar principles and challenges apply not just to healthcare at the coalface, but also to the way in which health and social care is planned and funded. So next slide, please. We know that the NHS resources are both finite and scarce. We know, therefore, that our decision makers, our commissioners, have some very difficult choices to make. And this is where health technology assessment is so important. Would you move it on, please, just for one more click? And evidence-based decision making is the fundamental objective of health technology assessment. So the assessments we undertake at HTW are there to inform our commissioners and our decision makers to ensure the best and most prudent use of finite NHS resources, both at an individual, but also at a population level as well. Next slide, please. Now, health technology assessment is essentially based on this rather simple grid. Advance one click, please. So in undertaking our assessments, we consider the introduction of a new technology, a new treatment, a new intervention, as compared with current standard treatment, which is represented at the centre of this grid. So the grid allows a consideration along the horizontal axis of the evidence to support clinical effect, whether that be beneficial, in which case the technology would sit on the right-hand side of the midline, or whether there's evidence of lessened clinical effect as compared with standard conventional treatment, in which case the treatment would sit on the left-hand side of the centre line. So that's clinical effect. But also the grid allows us to consider the effect of cost and what the cost consequences and implications would be in implementing a new technology or treatment. And that's considered on the vertical axis of this grid. So implementation of a technology which would be cost incurring would appear above the line, and anything which saved the system money would appear below the line. So our assessments allow us to integrate these different parameters to get a feel for where a new technology might sit in regard to comparative current treatment, both in regard to clinical and cost effectiveness. And I want to illustrate the principles of this and how we've applied this to two examples. These are examples that have resulted in HTW guidance publication over the last couple of years. The first example, a very complex intervention that comprised not just non-drug, but also drug interventions. And the second, an example of how we've applied these principles also to a digital technology, or a technology with a digital component to it. So if we could move to the next slide, please. Multiple sclerosis, relapsing remitting MS, is a lifelong condition, and we know that it carries with it a considerable burden for patients of morbidity and suffering. So conventional treatment for relapsing remitting multiple sclerosis is the use of disease modifying therapies, DMTs. But we know, whilst these are effective in many patients, they are both costly and they carry risk for patients. And there are a proportion of patients who have continued relapses despite the use of these drugs. And this is the background to this topic that we considered in our appraisal panel. So the topic is the use of autologous hematopoietic stem cell transplantation for relapsing remitting multiple sclerosis as an alternative to disease modifying therapies. And having assessed the evidence, our conclusion was that there was good clinical benefit established for this particular intervention, in that it increased progression-free survival, slowed the onset of disability, and improved assessment of quality of life for patients. But at the same time, the very detailed economic analysis, which incidentally was the first that had ever been done, we understand, for this particular intervention, concluded that not only was this intervention more effective for patients, but that overall it was less costly than the use of disease-modifying therapies for patients with highly active disease, in other words, disease that had not responded to 2 different disease-modifying therapies. So if we can move to the next slide, please. So just returning to our simple grid, the integration of both the evidence around clinical effectiveness and around cost effectiveness would place this intervention down in the bottom right-hand quadrant of this grid. And in terms of health technology assessments, this really is the sweet spot of where a new intervention needs to be. In other words, it's going to offer patients benefit, but it's also going to offer cost savings through implementation for the system as well. Now, before we prepared this guidance, there were no intentions or plans for this type of treatment to be established in Wales, but following the publication of our guidance, we're pleased that our commissioning colleagues at WISC, specialist commissioners, have now identified this as a priority on which to base a commissioning strategy so that patients can now be treated in Wales, as opposed to having to move either to England or further afield to receive this therapy. And next slide, please. So let's now think of a technology that has a digital component and apply similar principles. Diabetes, again, is a condition associated with substantial morbidity. It's a lifelong condition for patients often. And we know that for diabetics, the evidence says that by optimizing blood glucose control, we can improve both short and medium-term outcomes for patients and also reduce the likelihood of long-term complications as well. So optimizing blood glucose control is a major objective for diabetic patients. Now, standard monitoring at the moment involves the use of skin prick testing, which is both painful for patients and also inconvenient for them as well. Now, this new technology which we looked at, Freestyle Libre, is used for what's called flash glucose monitoring. The technology sits, as you will see from the picture, on the outer aspect of the upper arm of the patient. It's got tines that penetrate into the subcutaneous space and allow for the continuous monitoring of interstitial blood glucose. So instead of a patient having to prick their fingertip, they scan just over the device with either a mobile telephone, smartphone with the appropriate app, or a separate device, and that provides both real-time and also trends in blood glucose over the previous few hours. And for patients, that means they can assess their blood glucose more frequently, and they can then change the insulin dose and refine their insulin dosing regime to optimize their blood glucose control. So when we did the assessment of this technology in September last year, the appraisal panel concluded from the evidence that this technology did indeed improve the proportion of time that the blood glucose was in target range, and therefore reduce the amount of time it was either too low or too high. Now, when a health economic assessment was done on the use of this technology, it was concluded that there would be indeed an increasing cost associated with this as compared with standard treatment, but that when assessing the quality adjusted life years associated with that cost, the intervention in patients with type 1 and type 2 diabetes requiring insulin was comfortably within the cost effectiveness range. So if we can move to the next slide, please. Once again, applying that grid, we would conclude, therefore, from the evidence that this is a treatment, it is an intervention for monitoring blood glucose, I should say, that is, on the one hand, both clinically effective as compared with standard treatment, and whilst cost incurring, is comfortably, comparatively cost effective, and therefore would represent a very good value for money from NHS resources, and therefore we produced positive recommendation to support adoption. So next slide, please. Talking more broadly now, over the last 4 years, since 2017, we have received more than 300 topic notifications for consideration at HTW. These have mostly come from the NHS and from industry, but we've also had notifications from government, from the third sector, and from academia as well. And assessing these topics has resulted in the output of more than 150 topic exploration evidence reports, 35 assessments of the evidence in more detail in order to then inform decision making, and we've published now 23 pieces of HTW medical technology guidance on our website. Next slide, please. And when we considered all of the guidance that was published within the first 3 years of our existence between 2017 and 20, the HTW team concluded that if fully implemented by the healthcare system, then more than 137,000 patients per year would positively benefit from that implementation, and that more than £5.75 million per annum could be saved in resources for NHS Wales. So there's a lot at stake, potentially big impact of implementing the guidance recommendations that comes from the guidance that we have produced. Next slide, please. But our job doesn't stop at just producing the guidance. We need to then ensure that the system both is aware of it and acts in response to that guidance. So adoption is a very important part of our role in terms of promoting outcomes. This process is overseen by the All Wales Medical Directors Group, both in collective terms, but also in individual terms. So our medical directors oversee individually for their organisations the project of promoting adoption and auditing it. And they've done this through the appointment from each of the health boards, a lead individual who facilitates communication between HTW and that health board, and a committee that they chair within their organisation that promotes implementation. And we promote adoption, not just of HTW guidance, but also NICE guidance relating to non-drug technologies as well. We've established with our partners in the health boards appropriate methodology to do the audit process. And we've also now embarked upon an audit project, which is now coming to an end, where we have feedback from the health boards in 8 carefully selected HTW guidance recommendations that have been produced over the last few years to get an idea about the system responses to each of those. And this will result in the creation of our first audit report that will be going to Welsh Government, we hope, in the next few weeks. Next slide, please. This is just a list both of the organisations, the committees that they have within their organisations overseeing this function, and also the individuals who've taken responsibility and leadership within those organisations. And this is an opportunity for me to say thank you to them for stepping up for this. This is going to be a very important part of our work, and we look forward to working with them increasingly. Next slide, please. So let's turn now to digital considerations. Why are we targeting digital innovations at this stage for HTW attention and appraisal? Well, firstly, we perceive a great opportunity. We're, of course, all aware that over the last few years, there has been an explosion in digital technology development. We have available out there a wide range of digital technologies that have the opportunity and potential to significantly improve not just the quality, but also the efficiency of care. So we see an opportunity. But we also see expectation. We know that there is growing public acceptance and confidence in the use of digital and remote health. We want to take that opportunity to be able to support that growing expectation. There's a timeliness. Susan has talked already about the challenges that we've faced over the last 2 years during the COVID-19 pandemic, but we've also, all of us, I'm sure, seen great positivity and great opportunities that have arisen from the pandemic, included amongst which is highlighting the fact that digital technologies have the potential to improve patient care and patient management at pace and with impact. And then finally, strategically, it's important because we know that Welsh Government have identified in A Healthier Wales the intention to adopt emerging technologies such as artificial intelligence, machine learning, precision medicine, genomics, the intention to increase investment in digital infrastructure and technologies and workforce capacity. And I'm sure we'll hear a little bit more from that about that shortly from Glyn Jones. So next slide, please. And how do we intend to go about achieving these aspirations? Well, firstly, we need to identify appropriate technologies. We're planning a digital open topic call for later in the summer, and I'll talk a bit more about that in a moment. In preparation for that, but also the assessments that will follow, we have created an HTW digital task and finish group, both to help us determine the intentions and the objectives of the topic call, and then what we should do once we've received those notifications. Collaboration with our system partners and stakeholders, we've talked about already. This is more important than ever within this particular field, to ensure that we're well prepared for assessments that we're going to undertake, and to ensure that we give the best opportunity and chance for our outputs to be well received and impactful by the system. So next slide, please. So our planned HTW digital topic call will happen in July of this summer. It will be targeted, but the important thing is it's going to be entirely open. So we will welcome notifications from clinicians, from healthcare professionals, from professional organisations, from social care users and providers, from patients, members of the public, from developers, from innovators, from collaborating organisations within the digital space. And we've got great representation today in our meeting from you all. So we look forward to receiving notifications from you during that topic call. And once received, notified topics will then be subjected to, firstly, evidence-based topic exploration by our HTW researchers. We'll be scoring against agreed criteria, so objectively there will be a process of selection which will be overseen by the HTW assessment group, who will then select specific technologies to progress then to formal assessment by the appraisal panel, ultimately resulting in formal HTW guidance being produced and published. And next slide, please. Our HTW Digital Task and Finish group is chaired by our own David Jerome, from whom you'll hear more later on. The group has already had 2 meetings and has a number more planned in the diary. We have wide representation in the group. We've got representatives not just from Health Technology Wales, but from Welsh Government, from Tech Cymru, from Digital Health and Care Wales, from Life Sciences Hub Wales. We've got academic representation from Swansea University, and we have clinician representation with 2 clinical experts with particular digital expertise as well. Next slide, please. And this task and finish group will be addressing some really very important questions. Firstly, what should be the remit? What should be the reach of the topic call to ensure that we spread ourselves as widely as possible and make as many people aware of our desire to receive notifications? But some fundamental questions. How do we define digital health technologies? How do we classify those technologies? Which are going to be most suitable for our appraisal as an HTA organisation? Who are the key stakeholders within Wales with whom we should engage and make sure that we make them aware of our desire to receive topic notifications, but also how can we support them in that process? Some practicalities. Is our suggest a topic form, which we currently use on our website, is that fit for purpose? Does the information that we provide to potential notifiers, is that adequate, or do we need to alter that specifically for this topic call? And then finally, once we've received topics, really importantly to us, do we need to adapt our methods of selection and appraisal to be digital specific? In other words, answering the question, hopefully, is digital different to other technologies and other topics that we've taken on board and worked with over the last few years? We hope that this Task and Finish group will serve as an advisory group to HTW with answers to these questions so that we can adapt our approach accordingly. So next slide, please. So coming to today's event, today we really want to raise awareness with you of the digital open topic call. We would like you to engage with us and consider topic notifications. We are eager to learn more about Welsh Government digital strategy. And in particular, as organisations, together and individually, we want to understand how we could best contribute to fulfilling the objectives of that strategy. We're eager to provide innovators with a greater understanding of how technologies are evaluated by HTW, both for health and social care. We want to think about and discuss some of the challenges, some of the hurdles involved, not just in identification, but also in the adoption of digital solutions for health and social care in Wales. And finally, we want to strengthen our collaborations with all of our partners within the health ecosystem and discuss with them and agree with them what the next steps should be. Next slide, please. So, as Susan has already told you, we've got a busy agenda for you this afternoon. We've got some eminent speakers to hear from. The first session, which is going to be moderated by Susan Miles, will include a talk from Glyn Jones from Welsh Government and from Stephen Frith for Digital Health and Care Wales, to talk about firstly the digital strategy for Wales from government, but also about the NHS digital app. the NHS Wales app. And then in the next session after that, we'll hear from Verena Wolfram, speaking on behalf of Nhs and David Jerome, to talk more specifically about how digital technologies should be evaluated for the health and social care sector. After a break, we're going to go into an interactive session, which will allow you the opportunity to get involved as well. This will be led by HTW researchers to illustrate examples of how the NHS Evidence Standard Framework for Digital Technologies might be applied. Lauren Elston is going to present a digital case. And then to conclude the afternoon, we've got Delith James and Lauren talking about what the next step should be. And finally, Susan Miles and Carrie-Anne Quinn will conclude with some remarks at the end of the afternoon. So I very much hope you enjoy the agenda. Once again, a warm welcome to our event. And at this stage, I'm going to pass over now to Susan Miles to moderate the first session. So Susan, thank you.
Thank you so much, Peter, for that great overview and welcome, and for setting the scene so well for our afternoon session and for our next two presentations. So we're going to go straight into those next two presentations. The first will be on the digital strategy for Wales and the second on the new NHS Wales app. So I'm very pleased to welcome Glyn Jones, who's the Chief Digital Officer at Welsh Government, who will present an overview of the digital strategy. And just a brief bio on Glyn. So Glyn has been Chief Digital Officer in Welsh Government since July 2020. He's responsible for leading the digital data and technology profession in the organisation, and he advises ministers on digital policy and strategy. He also sponsors the Centre for Digital Public Services and the delivery of digital corporate services. Within this role, he also leads our data strategy, policy and knowledge and information management, and he's Director of Analysis for Welsh Government. And prior to doing all of that, Glyn was the Chief Statistician for Welsh Government from 2003 and a Senior Advisor to Government on all statistics. He was also co-director of the Administrative Research Data Wales Partnership. So with that introduction, thank you, Glyn. I'll pass over to you to tell us more about the digital strategy for Wales.
Yeah, thanks very much, Susan. Diolch yn fawr, Susan. I'll put my slides on the screen. So bear me a second. It's great to be here today, and thanks for that introduction and my long job title. Bear with me. Right. Right, there we are. Susan, give me the thumbs up that you can see that, and I will crack on. Yep. Yep, great. Okay. Right. Well, as I said, thank you very much for the invite. Diolch yn fawr am y gwahodd I siarad yma heddiw. Mae'n bleser siarad gyda chi i gyd am strategaeth digidol ar gyfer Cymru. Os ydych chi'n siarad drwy Cymraeg, dwi'n ymddiheuro, di'r sleidiau ddim yn ddwyieithog, ond mi fydd y sleidiau ar gael os ydych chi eisiau nhw yn y Gymraeg wedyn. Fel mae'n digwydd, dwi ddim yn mynd i siarad llawer am technoleg na iechyd i ddweud y gwir, ond dwi eisiau siarad am cyd-destun y strategaeth digidol a be mae'n feddwl i gwaith ni gyd ar draws y sector cyhoeddus, a falle sut gallech sesiynau heddiw ystyried y strategaeth digidol. Thanks for coming to talk today. I just explained in Welsh that I apologise the slides aren't bilingual. They will be available in Welsh if anybody wants a particular copy later on, and I'm happy to answer any questions in Welsh as well. So as it happens, I'm not going to talk very much about technology, and I'm not going to talk very much about healthcare either, so I'll apologise up front for that. But what I want to do today is talk about the digital strategy for Wales, what it means for us as a public sector, and maybe give you some food for thought about how healthcare technology, healthcare digital can fit into that strategy to help us achieve the objectives ministers have set out in terms of our digital strategy for Wales and our missions. So a little bit of looking back to start with, how we got here. So back in 2019, Lee Waters, who was then a backbencher, led an expert digital panel to look at how our public services were using digital technologies and how they were serving citizens. He brought together some public service leaders and digital experts to advise him on that, and he published a report called the System Reboot Report, which had quite a number of significant recommendations about stepping up in terms of our delivery of public services in Wales. delivering them around the user, and I'm going to keep at that over the next 20 minutes or so, to develop digital leadership in Wales, to develop new standards, to look at how we're spending our money, and to do this with a sense of pace and scale. He also made recommendations around an ecosystem for chief digital officers, which I'll talk about in a bit. So that was a report from Lee as a backbencher. He then came into the government, of course, and during 2020 took responsibility for the cross-government digital portfolio. So that means he has the lead responsibility as a minister for setting the overall context in terms of digital strategy for Wales, bringing together all the things I'm going to talk about today. But obviously, a huge amount of digital delivery is actually in ministerial portfolios. So convening those portfolios, bringing them together, thinking about how we're doing this as a government and as a nation, but delivery being within the Welsh Government ministerial portfolios and departments. So in 2020, despite us being bang in the middle of the pandemic, the Deputy Minister, as he was then for Economy and Transport, he was really keen to push forward on taking forward the system reboot report and setting out a digital strategy for Wales, which really set a vision and a context for all the work we were doing. So in the autumn of 2020 into the new year of 2021, we did a wide-ranging engagement on the digital strategy for Wales. Lee spoke about it in the Assembly. We blogged about the different missions. We were trying to crowdsource as much as we could. We ended up in a whole number of events, such as this one and others, talking about the digital strategy for Wales and really trying to get a consensus of what our sense of ambition and vision should be on digital in Wales. And what we heard, the key themes we heard from that, I mean, they won't come as a surprise, in honesty. We had a lot about digital skills, how providing technology was one thing, but we needed to provide the training and support to use those digital technologies, but also to make sure we had the pipeline in place to invest and deliver new digital technologies in Wales. Digital inclusion, making sure that everybody could access digital services or support was there for those people who couldn't access digital technologies, and connectivity, and the need to make sure that we had universal superfast broadband coverage everywhere and try and address those pockets of poor connectivity. So those were the big themes we heard from the consultation, but nobody really disagreed with our premise, which is around raising the bar, an expectation that through digital in Wales we would improve the lives of everybody by improving collaboration, innovation and delivering better public services. So very much this is not a technology strategy, this is a strategy around a way of working, a way of thinking, a culture of digital innovation, a culture that public services should be digital first, but the people could access public services in the way they wanted to. So I noticed there was somebody from Uber on the chat earlier. How do people access public services in the way that they use Uber, Amazon, their banking and so on? That's the ambition we've got. And through the digital strategy for Wales, trying to set out a number of missions to help achieve that. So the strategy is based around these 6 missions. There's a mission around data and collaboration. So we want to make sure that data is being used more effectively for decision making, that we're flowing data and sharing data effectively to support digital services and public services, and that we're using it in innovative ways to support new technologies, such as the example Peter gave just a few minutes ago, actually. We've got some commitments there on digital connectivity and particularly our work with the UK government to make sure that the UK government, this being a reserved area, delivering for Wales. We've got commitments around digital inclusion, as I said, and some things we're taking forward there include the exploration of what might be a minimum digital living standard for Wales, which is a really exciting piece of work that's underway at the moment. Digital skills, as I said, it came up strongly. So the digital skills looks at this from all angles, both from the digital curriculum in schools through to post-16 apprenticeships, but also what it means in terms of the workforce and a pipeline of skills. Digital economy, how do we drive economic prosperity by building up clusters of particular areas of expertise in Wales, but also what does it mean in terms of our future approach to remote working in Wales and ministerial expectations around that post-COVID. Finally, and I've left it to the end because this is going to be the theme of the rest of my talk, is about digital services. So everything we talk about here is really to support those digital services, so they're designed around user needs and that they're simple, secure and convenient to use, so that we're seeing the citizen, the user, the patient at the heart of everything we're doing. So when you're designing healthcare technologies, to think at all times of how is this making people's lives better, and to do really strong user research to understand the pain points users are facing and how we might go about doing that. And in that, in the healthcare context, we also do mean staff, people working within the NHS. They need digital processes that help them do their work as effectively as possible. So one of the key planks of our ambition is around collaboration, and I mentioned earlier in the Lee Waters report, he talked about chief digital officers and an ecosystem of chief digital officers. So that's me there, chief digital officer for Welsh Government. So I'm responsible for various things within Welsh Government. In 2020, we appointed for the first time ever a chief digital officer for local government in Sam Hall. And Sam has a small team who are working with local authorities to help them understand digital, to train them up, but also to take forward specific projects with them, and also to provide leadership on particular matters. We have tried to recruit for a chief digital officer for health and care. That wasn't successful last year, but the process is underway again now. In the meantime, many of you will know Ivan. He has been supporting us all in this work as the Director for Digital Health in Welsh Government, but he's soon to be joining Digital Health and Care Wales. And I know Ivan apologise for not being able to come today. I will talk a little bit more later on about some work Ivan's been doing around the digital health strategy. We've also got a new Centre for Digital Public Services. I will talk a little bit more about that in a second. And Harriet and Myra are the joint chief executive officers of the Centre for Digital Public Services. So they do that on a job share basis, which is a really exciting development as such a senior post in the Welsh public sector. They joined in January. They joined us from being chief digital officers in DEFRA, and in speaking to Harriet and Myra, it's great to hear them tell me how part of their attraction for coming to the job was hearing what we're doing in Wales across the public sector and how we're working together to take forward this agenda. So that's really nice to hear, and it shows how we've got a bit of momentum and excitement being created. So the Centre for Digital Public Services, as I said, it's a new arms length body. It came into being in 2020, and over the past 2 years, it's been growing its capacity and workforce. We did a bit of discovery in 2020 to think about what we wanted to have the centre for. And what they identified the key problems were across the public sector: lack of understanding of what we meant by digital. So therefore, there wasn't the drive from leadership to support or champion digital ways of working. There wasn't a common understanding of what we mean by digital. To some people, it meant the laptop on your desk. To some other people, it would mean an online form. To some other people, it means a way of thinking and a way of working. Public sector across the piece have got a lack of digital skills and capability in most areas, both in terms of technology, but also user research, business analysis, and so on. The centre is there to help share, collaborate and co-create, but also we identified a lack of common technical and service design standards. So those are really the key things we set up the centre to deliver against, and these are the key objectives of the centre. Provide leadership, working in partnership across public services in Wales. So really the centre is trying to set the agenda, trying to demonstrate and work with public services to drive forward the leadership around digital. And they've been doing that by training senior leaders across public sector, chief executives, political leaders and so on, in understanding what we mean by digital and digital transformation. They've been working with some organisations, and I'll give a few examples in a minute, around specific public sector transformation projects, very much doing with them, not doing to them, so that as well as delivering a nice new end-to-end process, they're actually supporting cultural change within the organisation. Sorry, that's my flash on my screen. Building communities of practice around particular areas to support us working together, and a really important part of this collaboration is that we are learning from each other. And if somebody is developing a particular platform in one part of the public sector, can we reuse those patterns or designs elsewhere? That we're not having 22 local authorities designing the same thing 22 different ways, same across health boards and arm's length bodies as well. That we're sharing standards, that we're sharing guidance and all those good things. They will help develop and build digital skills and capabilities across the public sector. I talked about training at a senior level, but also training staff, digital or non-digital, to help them understand how they might go about doing things. I've talked about standards, but also driving forward the new culture of working in the open, logging, providing updates and making sure we're being transparent in everything we do. I'm mindful of time, so we're going to start rushing through. There's the Centre for Digital Public Services website. One of the first things the Centre for Digital Public Services did was set out a set of digital service standards for Wales. These were done in a very collaborative and consultative way. So they put them out in a very early form and got people to comment on them. They're very similar to things you may have seen from the Government Digital Service, with the added twist around the Welsh flavour to this, around the Future Generations Act and the need to use our digital services to promote the use of the Welsh language in line with our ambitions around the use of the language in Wales. Centre will be shortly developing a service manual to support the use of these standards, to help public services not only see the standards but also think about how they can put them into practice. And a lot of these obviously will chime with the agenda you're talking about in the next 2 days around technology and ethics and basing decisions on data and research and so on. So here's some examples of where we're sort of seeing the digital strategy in practice in terms of working collaboratively, seeing the Centre for Digital Public Service having a role. So they're working with Sports Wales on looking at how they can widen the reach of their sports grants. They've identified some pain points where people were being put off applying for sports grants and working through those problems. They're working very closely with Neathport Talbot on a new service around text messaging for adult social care clients, so to be kept informed around their journey through social care. They're working with Natural Resources Wales on hazardous waste, which is around how they can reduce the number of touch points with NRW and other people for citizens and providers and everybody else. I don't know much about hazardous waste, but people who have to interact with what you can imagine is a whole load of paperwork to make sure hazardous waste is being dealt with safely. They're working with the Welsh Revenue Authority on a project around data and land, and many others there where the centre is playing a role, but also we're working collaboratively across the public sector to think about how we can do things together. A really important part of what they're doing is the digital landscape review. This has been stepping back and looking at our public services and identifying how well they're being done digitally. Are they being delivered in a digital form? Are they available online? If they're not available online, what else is offered? What's the technology stack? Are we reliant on legacy tech and so on? So they've been reporting very frequently on that in the open. They've I think reported on both the alpha and the beta of that work. We've also seen the third sector step up as well, and they've beginning to develop a new partnership called Nhwyd, which is delivered by the WCVA, Wales Co-op Centre and Promo Cymru, to look at digital assessment of the third sector and to look at promoting good digital practice across the sector in Wales. Very much aligned with what we're trying to achieve through the digital strategy. And then in health particularly, there's masses going on in health. You'll talk about a lot of that over the next 2 days, and this is certainly not going to do justice to all the fantastic work that organisations such as DHCW and others have been doing and have been doing, particularly over the past years.
I can give them that number, the National Insurance people. It came attached to something. Check.
Can we mute, please? Thanks. But no, here's a few examples of where we've seen the principles of the digital strategy come to life in health. So Stephen is going to talk to you in a minute about the NHS app and the digital services for patients and public programme. The Centre for Digital Public Services are working with Stephen and the team around primary care to do a piece of discovery to get insights from patients and GPs on how people in Wales get access to primary care, and to think about how we can design the primary care element of DSBP with users at the centre, and that's a really exciting and important piece of work, which is getting really good feedback from colleagues. The Wales Nursing Care Record is a digital system which I'm sure many of you know about, looking at how nurses record, store and access patient information, and this has been done in a very user-focused way, working with users, nurses and clinicians to understand how the data will flow and what data access they need. The digital medicines transformation portfolio, which I think is the same thing as e-prescribing. The Centre for Digital Public Services working with the NHS and DHCW to look at that from a user focus in terms of all the manner of users throughout the system who will need to use the digital medicines transformation programme, and how that can be designed around the user need and not just technology led. Some more examples here, but I know I'm running out of time. We're rolling out training to the NHS in terms of user research, training NHS leaders on user-centred design, and more of that will follow. And you know, it's great to see so much of this being recognised nationally and internationally in terms of the success of DHCW and the NHS for the fantastic things they're doing. So you know, what we want to do is build on that and do that in the context of the digital strategy for Wales. I've talked about working in the open, so some examples of what we mean by working in the open: podcasts, blogs, Twitter, sharing what we're doing, getting people involved in it, getting people excited by what we're doing, and therefore providing a sense of iteration and agility around what we're doing, not going away, do a business case and then in 3 years' time deliver something that nobody wants, but really do it out in the open and getting people involved and, you know, getting the sense of excitement about what we're doing as well. That's it. What we want from you, if you're in the NHS or outside, you know, leadership, really important that we're positive drivers for change in how we are providing public services and thinking digitally first, thinking about how everything we're doing, whether they are healthcare technologies, online services, are designed around the users, thinking about the skills you need in your team. The only thing I haven't mentioned, I'm sorry for this, is the digital health strategy. So this is something that Ivan is leading at the moment in Welsh Government, Ivan Evans. He has had some colleagues going around doing consultation events with different groups of people. It's being developed at the moment. The aim is to build on the collaborative approach that we've seen during the pandemic and, you know, push that forward. It will be intended to be published over the spring. I think idea is to start wrapping things together in April and publication in May. So I'm sure more information can be asked about if needed. I'll leave it there. Diolch yn fawr am wrando. Gobeithio bod hynna yn rhoi dipyn bach o cyd-destun I chi ar y strategaeth digidol ar gyfer trafodaethau dros y 2 ddiwrnod nesaf. Thanks very much for listening. I hope that gives some useful context around the digital strategy for Wales for your discussions over the next couple of days. Diolch.
Thank you, Glyn. That was a great overview of the broader digital strategy and great context in terms of thinking about how that will fit round about digital strategy within care systems within Wales. So please do, colleagues, post any questions that you have in the chat. We received one in advance from Simon Jones, Chair of DHCW, which I've posted already. But if you do have any questions for our speakers following Stephen's presentation, then please post them in the chat. OK, so moving on, our next speaker is Stephen Frith. Stephen is Director at Digital Health and Care Wales and has been leading and overseeing the development of the new NHS app. Stephen's worked on informatics for over 30 years. He ran the informatics department at the Oxford Radcliffe Hospital and then worked with the company establishing XML-based NHS messaging platforms before moving into the NHS Information Authority. He's worked on several large-scale government IT programmes, for example, the All Wales Shared Networking Platform, PSBA, and as Programme Director for the Welsh Digital Services for the Patient and the Public programme, he balances the need for innovation and progress of open data and the importance of data integrity and the protection of personal data for individuals. So over to you, Stephen. Thanks so much.
Thanks very much, Susan, and thanks, Glyn. I don't have a presentation, and I don't have much of a script, but I think I've got 15 minutes until we move to the Q&A. But what an exciting time to be working in digital services in the public sector in Wales. There's a lot going on, and I think the next 12 to 24 months we're going to see some very, very exciting developments and digital services being made available to the general public in Wales. So very exciting time. And whilst a lot of my presentation is going to be focused on health, I hope that a lot of what I say is extensible, and a lot of the technology that we're talking about is extensible into the social care and the wider public sector in Wales. And whilst I don't have a presentation, there's two things really that I think I want to get across in this presentation. And the first is that the DSPP programme is wider than just delivering the Nhs Wales App. It's very easy to focus on the Nhs Wales App as a piece of digital technology, but the programme is wider than that. And the second point I want to get across is that the Nhs Wales App is being established to be a kind of an extensible gateway. So I'll unpick both of those points hopefully as I go through a presentation. So a presentation in three parts really. One, talking about the DSPP programme, how it's set up and what it's trying to achieve. Secondly, about the Nhs Wales App and how that's being set up to be an extensible gateway. And then thirdly, an update on where we are in terms of our kind of programme timeline and what we expect to deliver over the next 12 months. So in terms of the first of those, the Digital Services for Patients and the Public as a programme, it's sponsored by the Welsh Government and it's delivered within DHCW. And it's ostensibly been set up to support the deployment of patient-facing digital services to underpin service transformation, new ways of working. And all of that is absolutely key from my perspective. It is all about patient-facing, interacting through digital services with members of the public. And it's also all about doing that in a way that supports and reacts to new ways of working, new models and service transformation, and particularly not technology first, but service transformation first, digital services being available to underpin it. And the design of the programme is largely informed by looking at what people are doing and trying to do and the difficulties they get to in the deployment of digital services. Because there's no shortage of enthusiasm to move to digital services, and many people can see the benefits and the improvements in service, the improvements of the public experience, and also the efficiency of using digital services. We use digital services all across our lives, from banking to booking holidays to paying bills. Taking out insurance, and the public sector engagement should be no different. And there's a lot of initiatives moving towards using digital services, but particularly in healthcare, looking at the initiatives, they quite often run into a number of common issues and problems. So top of the list, most people would say access to data from within the NHS to support digital services is problematic. And data sharing and capturing data and feeding data back into the NHS is also problematic for people deploying digital services. So that's a big problem area that we want to help address. And the second is identification of individuals, which is absolutely essential if you're going to move data from the NHS data domain into the public domain and back again. You need to know that the person at the end of the digital service is the person that you think they are. So the advantage of Teams is I can see that Luca has not got his microphone muted. Thank you, Luca. It flashes up when someone speaks. So look, moving on to the design of the programme, we kind of describe it in 5 broad areas of delivery. So the first is around data interoperability, and particularly working with the NDR programme within DHCW to set up improved ways of data sharing. I'm not going to go into too much detail. I think most people on the call will know why it's difficult. A couple of reasons. One is the security around health data and making sure that actually you know exactly what data is going where and how it's being used. But the other is a legacy of bespoke integration where data is moved from one system to another through a sort of a bespoke service that's set up, and that's just not extensible. As you get many different services, you get a kind of a bird's nest of integration where data is moved, and quite often a lot of these kind of bespoke services are they come with one person that set it up, and that person knows how it works and no one else does, and that's just not a sustainable way going forward. The architectural review and the national architecture that came out of it for the NHS in Wales talks about moving towards a more of an API-based, standards-based sharing of data, and the NDR programme is setting that up, and we're working with them as a kind of key driver of that service, particularly to enable the movement of data in and out of the NHS and into the public domain and back again. So that's the first of the 5 areas that we're working on as a programme. The second is identity management, and where we're working to take a service from NHS Digital, the NHS login service, and use that to underpin our identity management for the Nhs Wales App and digital services in the health and care environment in Wales. The third area that we're working on is around the ethics and information governance, and I was particularly keen that we were able to set up a work stream under that kind of umbrella, because we don't have to go too far with deployment of digital services, particularly in the health and care environment, before you hit some kind of information governance challenges and lack of clarity as to what the rules are and what the approach is for, I mean, just 2 specific examples, young people accessing medical records and at what age they do it themselves versus have proxy access for a parent and guardian. And second example, digital services around issuing test results, where the test result is particularly sensitive, and to what extent that goes by a text message that arrives on the phone in the pub at 9 o'clock at night versus needing to go through a clinician to sign off the release of information. So loads of ethical issues, and these are not medical ethical issues, these are digital ethical issues, I would argue, that are inherent and come about because of the move to digital services. So we've set up a strand within the programme to create an environment for debating and creating the concept of a rule book and a changeable set of rules in terms of what the agreed policy and approach is for ethics and IG in this space. The fourth of the digital services that we're setting up is the gateway application, the Nhs Wales App, which I'll talk about in a little more detail in a moment, but that clearly is a key component of what we're doing within the programme. And then the fifth area is a resource centre and setting up a centre of excellence where third parties and technical innovators can access technical documentation, work out how to interact with the technical digital environment within health and care in Wales. So that's the programme, and as you can see, the actual Nhs Wales App is just one part of a wider programme around supporting and collaborating. And Glyn mentioned the Centre for Digital Public Services, working with Centre for Digital Public Services to set up a much more collaborative and joined up approach to development of and deployment of digital services. So that's a very quick skim across the aims of the programme and the way it's set up. But for the purposes of this particular presentation, I was going to focus on the Nhs Wales App and what that's going to do and how it's being set up. So we've let a contract to a company, a specialist company called Kainos, and they have taken a copy of the code from the NHS in England, the Nhs App from England, and used that as the starting point for the Nhs Wales App. But I'm at pains to point out that it's not a lift and shift, it is a starting point, and one of the key parts of the vision for the SPP and the Nhs Wales App is about extensibility and supporting a kind of plug and play type environment to multiple third-party developed digital services. And really that's to address one of the kind of key challenges that we've got really, which is how do you create a cohesive public patient experience without accidentally trying to create a single solution that does everything? Because we all know that if you try and create a single digital service that does everything, even in healthcare, then you will fail. The healthcare delivery environment is so large and complex that you can't have one digital service, it has to be a collection. And yet we want to have a joined up, cohesive digital presence. We don't want members of the public to have 100 different apps and have to work out which app they have to load up depending on which particular illness they have and which particular part of the country they're in on a particular day. Not sustainable from a kind of patient experience, but also not sustainable from a back-end data interoperability and security perspective either. So we've developed the concept of the Nhs Wales app as a gateway app that provides a common front door to a wide family of applications, which allows for independent projects and parties to select best of breed, to change over time which particular digital service they're using for which particular area of service delivery, and to encourage supplier innovation. So that's a kind of key concept within the Nhs Wales app, that it will be a kind of an overarching gateway application that will facilitate single sign-on authentication of individuals, but then hand over control at key points on the patient journey to specialist subject matter expertise and third-party applications. So in terms of where we've got to on the journey of setting up that application and that vision, we started work in November last year, so we're only, 4 months in, so it's still pretty early, but we've made some fairly rapid progress. We did 6 weeks of discovery and then commissioned a proof of concept with Kainos, our third-party supplier. They've taken the code and already got a working demonstration of the Nhs Wales app. And when I say Nhs Wales app, it's both a website that can be surfaced on laptops and mobile devices, but also an application that can be accessed on mobile phones and mobile devices. So it's both application and website as a single service. And we've made it bilingual completely from the off. So from the first point of contact into the app and throughout the app, it's entirely bilingual, with every single page offering the opportunity to flick between English and Welsh language, which is no mean feat, but we've built that in from the ground up. And we've integrated the NHS login service. So this was all part of the proof of concept. And we've inherited the functionality that provides access to primary care data to facilitate things like repeat prescription functionality, and also access to primary care medical records subject to a GP giving approval for that. One of the things that's happened in the last couple of years and with the pandemic is the appetite to allow direct booking of appointments and to provide access to medical records and GP practices has taken a bit of a time out and needs a bit of a rethink, which is why we're working with CDPS to do a Pathfinder project in primary care to work out exactly how that kind of functionality needs to be developed and set up to provide members of the public with access to primary care services. And that discovery activity for that primary care Pathfinder project is coming to an end this week, in fact, and the results are going to be presented next week. But nonetheless, as a proof of concept, we have integrated into both of the primary care systems that are used in Wales to demonstrate that that technology is workable in Wales. And we've done a proof of concept on a access control, audit and transparency functionality, which is a bit of a first, I think, and it's still a little bit in the kind of proof of concept stage, but it's working with the Welsh Government data promise team and making sure that there is a way of actually technically delivering on the aspirations of the data promise. And whilst not live, we have built in from the ground up a framework that allows members of the public to actually start to see how data about them is being shared, who's accessed it, and potentially say yes or no to access in certain circumstances. So the framework is there. The approach to using bits of that framework needs to be developed, but that's built in at the very ground level of the Nhs Wales app, which is relatively novel and new in terms of the level of control that it provides for people in this environment. So watch this space for that one. And we've also augmented the NHS England app functionality with quite a lot more around patient captured data. So the ability for individuals to actually use it as a two-way communication tool and to start keeping communication preferences in one place, to update the NHS in one place when they change their phone number, for example, and to say whether they want an email or a post reminder for an appointment. So capturing that and also starting to capture what we call about me data. So data that relates to how an individual wants to be looked after if they come into the NHS environment for health and care. And we've done that as a proof of concept because it underpins so much of the vision for the NHS Wales app, ranging from the access to that data, the ability to control access to that data, to the challenges around getting that data into all the far and dark corners of the NHS and social care environment in Wales. It allows us to demonstrate a lot of the technical solutions to a lot of the technical challenges around data sharing and interoperability, based on data that it's very hard to argue is not absolutely in the domain of the individual, because it's data about them, and they are best placed to say whether it's correct or not. So we've got that in proof of concept. We finished proof of concept on the 28th of February and went straight into our next work package, which is to industrialise some of this functionality and create a service that is ready and fit for operational delivery, so that sometime in late spring, early summer, we can start to roll out some of these services and have the NHS Wales app live. But obviously to do that, we need to bolt on a few extra features. So we need to work out what we're going to do with the primary care record access. We need to build out on the functionality for integration of third-party solutions. So we're working on that. And most particularly, the interface needs to be extensible to provide a way to support the plug and play and the navigation to data that's held in third-party systems, and to do a managed handover from the user once they've signed on to the NHS Wales app into a third party for interacting with the service and the data associated with that particular area of service delivery, and then potentially navigate back into the NHS Wales app, all relatively seamlessly from the end user experience. So that's what we're working on at the moment. Timescale for that is to close that work package at the end of, towards the end of May. And then the next work package will be very much about live deployment and rollout, and adding in additional digital services around access to test results, medicines, working with the medicines portfolio programme in Wales, access to documentation, and obviously booking and rebooking of appointments. And it's a long list of features that we've got on the list. We're also going to be surfacing the access to the COVID pass in England through the NHS, COVID pass in Wales through the NHS app in Wales, and the rebooking of COVID vaccination appointments as well. So a long list of features coming out over the next sort of 3 to 6 months. So hopefully a whistle-stop tour of the programme and why the programme is bigger than just the NHS Wales app. A very rapid canter through the style of the NHS Wales app being a front door to multiple digital services, and a canter through the kind of the features that will be in the core of the NHS Wales app, creating a platform that people can innovate on and build out from, and offer a cohesive public and patient experience. So I'll stop there because I think I'm eating into the Q&A time, but hopefully that covered most of what people wanted to know about the NHS Wales app. Thank you.
Thank you, Stephen and Glyn, for very informative presentations that have brought us up to speed in terms of some of those key strategic digital developments across Wales. So thank you, lots of information. We've had some questions in advance, but also some questions coming in through the chat. So perhaps I'll kick off with the first one that came in from Simon Jones, and he asked that question: how do you think we can best ensure that sound health ethics are at the heart of digital technology and transformations? So for example, privacy, fairness, making the best possible judgments, etc. I guess either Stephen or Glyn, you may wish to take that one.
So, I mean, I'm happy to jump in on that because that's one of my kind of subjects that I'm very passionate about, and you'll have heard in my overview that I described that we've set up a work stream around ethics and information governance. So we've brought together specialists from the University of Swansea and from across the NHS in Wales, and from the legal services to bring together this kind of body of knowledge about actually what the current state of play is. So we would use that as our kind of assurance as we go forwards, keeping that very separate from the well-established approach to general medical ethics and treatment selection, etc., but focusing very much on the ethics and information governance complications of moving to digital services. So at least we've got a place we can take the difficult issues, and in fact we have the concept of a dilemma log. We haven't been able to come up with a better title for it, but we maintain a dilemma log of the difficult questions. But the second part is that, you know, I skimmed very quickly across the technology that we've already created that will allow people to be proactively involved. And whilst we're not advocating switching this on from day one, because the NHS would probably collapse if people were able to say, no, don't share that information about me with that person, the actual framework is sufficiently granular that it can go down to that level as and when we decide we need to. So, but particularly the three components of it that we've built are the concept of an audit log, so access to the data. It's already audited in the NHS anyway, but actually capturing that in a kind of a more central repository. Secondly, allowing the users to have access to that and see. You know, with a long-term expectation that at some point you could actually get a push notification into the application to say that this person looked at your record, and if you don't like it, you click a button to say that looks strange to me. As I say, not suggesting we switch it on overnight because that could be quite problematic, but aspirationally, if we are to live the concept of the data promise, that's kind of where we need to be thinking about heading towards. And the third thing, the concept of an access control panel, so people can actually say, I'm happy for this information to be shared with people directly involved with my care, I'm happy for this information to be used anonymously for medical research, etc. I'm happy to be contacted for particular medical research that relate to my conditions, and having that kind of level of sophistication in terms of patient and public input into how data is used and how they're brought into the process, I see as absolutely pivotal to maintaining and gaining patient trust in what we're doing with information, but also ethically being able to behave the right way and make sure that what we're doing is actually considered to be in the best interests of everyone in Wales. So very passionate about that, and I think we've set up the right framework for it, but now we just need the processes over the top to make use of those tools and get us to a place where we can be really transparent and open with what we're doing with data.
Thank you, Stephen. That's helpful. Glyn, you wanted to come in?
Yeah, please, Susan. So yeah, I agree with everything Stephen said, and those are really important. That's a really important part of that ethical dimension to the use of data and bringing people with us in terms of how we use their data. I spoke a lot about users and involving citizens, patients in everything we do is, you know, one dimension of this, around getting them to understand what we are, what the offer is in terms of a digital solution, and what it means for them as a patient in terms of their patient pathway or whatever it might be. The other part of this, though, is that thinking ahead of any project. So just because we can use the data is not necessarily the right thing to do. What impact will that have, and giving that real ethical thought to it. And I really liked Stephen. Oh, I've already forgotten the name of it though. Your log. What was it called again, Stephen?
We've called it the dilemma log.
Yeah, the dilemma log. That's great.
And we've got a rule book as well. So we've got a dilemma log and a rule book that we're developing.
Yeah. So we're in a sense, what we want is for the public sector to actually think about those dilemmas. What the what ifs around using data to make sure that is it the right thing to do with data? We may have a legal basis to do it, but is somebody going to be disadvantaged by the use of this data to create an algorithm, some AI, whatever that might be? But also, if we're introducing AI or innovations into a healthcare setting, it impacts on people's jobs. You know, we need to think all that through, and it doesn't necessarily mean something shouldn't happen or should happen, but we at least need to have that dilemma log, think through the things we need to do, who might be impacted by anything we do, which is the same for everything we do in terms of impact assessments. And a really important part of this now in terms of how we're using data is to think through, is it the right thing to do? One of the projects we've funded through a partnership we've got with the universities called the Wales Data Nation Accelerator is specifically on data ethics, and to do a bit of discovery around what information public sector need on ethics, to give them the advice and guidance they need to give those ethics and privacy considerations. So there's a whole load of material from the Centre of Data Ethics and Innovation. What else do public bodies in Wales need to help them on this? Because it isn't easy. It isn't easy. And another part of this is who's missed out from the data. So we know we have some data sets where completion is patchy. Ethnicity is one of those. So if we're producing an algorithm or some data analysis which relies on ethnicity as a field, there is a built-in issue because the data is incomplete. How do we address that? How do we overcome it? Those are really some of the ethical issues we need to think about on top of the controls and governance Stephen's talked about.
Thank you, Glyn. Just to note that David Jerome posted a question in the chat earlier for Glyn, asking if he could tell us more about the digital leadership, digital training offer of particular relevance to health and care. So Glyn's helpfully posted in the chat some of the masterclasses that will be on offer, but I don't know if you wanted to say anything more about that, Glyn.
Yeah, so I mentioned the Campus Digidol, which the Centre are developing. So this will be, these courses are relevant to anyone in the public sector, but they obviously are generic in scope. But feedback we've had on these courses have been excellent. I can't tell you now what the timetable is for the courses, and I also know that a couple of colleagues who've been working on it have been off with the dreaded COVID. So I keep an eye out on the website for the launch of those courses. They will be available. But as I said in the chat as well, we've also been rolling out a bespoke introduction to user research, again to try and drive up that culture of user-focused design across the NHS. Again, I think those are still going. There probably are spaces still available. If anybody wants, happy for you to get in touch with me and I'll find out who needs to do it. But the centre are also happy to have a conversation at any time, I think, about needs and so on, and particularly that leadership level. I know we've gone round exec teams and boards to try and raise the bar in terms of an understanding of digital. I'm happy to have a conversation if anybody feels there's other gaps we need to fill.
Yeah, thank you for that. And maybe at the end we can take some email addresses and make sure that we share them with the participants today. If anybody'd like to follow up with your permission, that would be great. There's also a general question in there, think about the app, which is asking, will the login be bilingual? And I guess to what extent will the app be bilingual? Totally, I hope.
So absolutely. There's three aspects to the answer to the question. So the actual Nhs Wales app, the core of the Nhs Wales app, is bilingual completely, 100%, and always will be. The NHS login is effectively an identification and authentication service provided by a third party, that third party being the NHS in England. And there's the concept of third-party integrated solutions, and the level of bilingual capability across each of those three areas is a slightly different answer. So as I say, for the first area, the Nhs Wales app, absolutely bilingual. The third area, integration into third-party solutions, the expectation is that they will be bilingual, and we've got a handover of the language preference to create a seamless experience. But I'm kind of sitting on the fence and caging my answer, because if there's an absolutely fantastic third-party application for a very specific area of clinical need that we absolutely want to deploy in Wales, then I suspect we would link to it with it being not bilingual, and probably expect it to have a plan to become bilingual within a certain period of time. So I suspect there'll be a flexible approach so that we don't inhibit innovation and restrict the marketplace of third-party applications and innovation that we're so passionate about and wanting to encourage. But that's my personal view, not necessarily the policy position. And the middle one, the NHS login, it's a complicated service. It's not well liked. It's considered quite difficult to get through. But the reason for that is that it drives a hard balance between making sure you know that the person at the end of the service is the person who should have that medical record, basically not failing, sending information to the wrong person. But that makes it quite difficult. It speaks to another question that's in the chat around accessibility. So whilst our app will be designed to be completely as accessible as possible, the actual login process we know already is problematic for people that have difficulty with digital services. So we're working with NHS Digital to improve and address that. And as part of that, making it bilingual. But in making it bilingual, you have to split the actual service that's being provided into two parts. There's an initial part, which is the first verification of identity, absolutely confirming that the person is the person they say they are. And there's 12 different routes through the NHS login approach for verifying someone's identity. And if you're digitally savvy and you've got a driving license and you can upload pictures and it works pretty well, then it's quite slick and you can do that quite easily. But if you haven't got a digital identity or that process fails, then you flip across into different pathways through that verification process that are increasingly difficult to make bilingual because they're people in a room talking to you, and the NHS in England are not particularly keen to make that a bilingual service. So we're having conversations about to what extent they can do that versus us doing it ourselves, but that's the harder end. Once you've gone through that verification, the next time you use the application, it's a system-to-system digital check. And those parts, like using your fingerprint or typing in a password, are the bits that we are working on to make bilingual now as we go forwards. But we haven't got the timescale to get to a completely bilingual experience of the automated authentication process. But that's on the roadmap. So we're trying to avoid the situation where you get a jarring in the experience if you're using the app in Wales in the Welsh language and then you drop out to a third party for identification that is in English, and then you come back to Welsh language. But at the moment, that is the way it's set up. So we've decoupled the conversation about making the NHS login service bilingual from the actual progress we're making with NHS Wales App. So it is an issue, and we are aware of it and addressing it, but to a different timescale.
Thank you, Stephen. Just to note that Glyn has posted in the chat the link to some of the digital skills training that was alluded to earlier, if you want to follow up on that. And Stephen, if you're content, it'd be great if you could post your email in the chat for colleagues to follow up, because I don't think we're going to be able to get through all of the great questions that we've received. But perhaps I can finish off the last question before we go to our brief break, which was posted in advance. And that was really to ask, what do you think will be the biggest trends in digital solutions for health and social care in the next 5 years? So it's quite a big question. Any thoughts?
I'll let you go, Glyn, first, because I was typing my email, so I'm going to have to find the question now.
I don't know. I mean, I'm sure there are other people on the call who will have a better sense of that than I. But I can only imagine it will be, demand for at your fingertips, ease of use. The kind of thing Stephen's talked about, the kind of thing I've talked about, the example given in Peter's talk about smart tech, bringing yourself to the centre of your own healthcare is how what I read and how I see it going. And I think then, how we then layer on top of that the exciting use of AI and so on, and all the ethical dimensions that comes with that, I think is the sort of driver for our response to that. I think so. Sorry, I'm not an expert in healthcare tech, but it feels to me that that's where it should go. And yeah, that but I'm also a citizen and a patient, and what I would like to see is that kind of thing, the kind of thing Stephen's building there around getting access to services and things the way you want to get access to them, and that's the really important thing here. Thanks.
Thank you. Stephen, did you want to add anything before we go?
So I facilitated a bit of a question time with some digital thought leaders in Wales a couple of weeks ago, and actually I was asking the questions and I asked them a very similar question, so I can steal their answers, which are interesting because they weren't answers from a kind of digital technical perspective. They were answers from a individual's interaction and digital services they would require, and they're all absolutely predicated, as Glyn says, on this kind of patient-centric, moving away from paternalistic models of care to more kind of self-selected, self-controlled models of care as far as possible. And the examples were ranged from going to a consultation with a GP armed with a load of evidence, knowing that your GP has actually seen that information that you've collected. If the specific example was someone with diabetes, and actually tied into the example that Peter gave in his introduction for home monitoring devices, our technical digital solution in the NHS Wales app will absolutely integrate with those services and provide a very easy way for that data to be fed into the person's medical records and shareable with the GP. So the person will be able to walk into their GP practice knowing that the GP has access to and can see all of those measurements, whether it's glucose levels or whether it's blood pressure or the fact that they've been for a run. All of that information will be there and accessible and shareable. So that's one. And the other example was around planned care and waiting lists, and actually being able to see where you are on a waiting list and when you were last looked at and how long you'll have to wait until someone actually looks at your information and telling you when they've looked at your information, and being kept much more informed of where you are in the process. And whilst you're on the waiting list, being provided with a whole load of digital resources to help you manage your current care needs, your current condition, find out information about your particular condition, and be put in touch with other people perhaps that have the same kind of needs. So far more proactively helping people whilst they're waiting for planned care. So they're two examples that were given, not mine, but great examples. My example is, because those two examples I think are in the next sort of 12 to 24 month time horizon. They are absolutely within reach very, very quickly with the technology that we're now seeing and setting up. My example for sort of 4 or 5 years time is when we've created this ecosystem of the information about an individual being conceptually all in one place. It won't actually be in one place, it'll be within the operational systems that support delivery of care, but conceptually from the perspective of the member of the public, that data is all in one place. When we achieve that, I think people will very quickly realise that the total power of that, because we already have the concept of proxy access and sharing access to information in part or totally with third parties, either where you need somebody to take over the management of your care or where you actually just want to discuss a particular aspect of your care with a family member or a friend. So you will be able to share your information through the technology and the Nhs Wales app with others. But actually, it's a really small step to say, actually, I don't want to share it with another person. I want to share it with an AI, a fantastically sophisticated piece of software that sits there in the cloud 24/7, looking at all my health information, increasingly plugged in and digitally connected, and tells me when I need to go to the GP to be seen, or tells me when I've actually eaten something that's bad for my health. And I think we'll see a huge increase in those kind of technologies that actually look at people's health in privacy, in a secure way, digitally, and based on algorithms and artificial intelligences. And I think that's what we'll see in the next 5 years. I think we'll see a huge explosion in that area.
Well, thank you both. A great answer to a rather crystal ball gazing question, but glad you had them on the stocks. So thanks, that takes us right up to our break now. So really just to say sincere thanks to Peter, to Stephen and to Glyn for some really great presentations and a stimulating question and answer session. We're going to take 15 minutes away from our screen. So if you could be back at your screen for 2:45ish, when we'll turn our attention to approaches to evaluating digital technologies with presentations from colleagues from Nhs and also from Health Technology Wales. So see you back here in 15 minutes. Thanks very much, everybody.
Thanks, everyone. Cheerio.
Hi, David. Hi, Vinia. You okay? Good to go? Lauren, were there any questions that we need to come back to that weren't answered, or we could just follow up by email maybe?
There were a couple, so I think we can follow them up afterwards and circulate.
Okay.
The event.
Yeah, okay, that sounds fine.
There's definitely at least one more for Stephen.
Right, okay. That was good questions though. Okay, just give it a few minutes and then once people are back, we'll kick off.
What we can also do is check with the presenters and include a little circulation list of contact details, because I'm seeing somebody's message saying that Stephen's emails bounce back. So we'll make sure that there's some email addresses circulated, just if you do want to follow up with anyone from the event.
Yeah, and I guess we don't need to share the slides because there'll be a recording, but maybe we'll send round the link to the recording if anybody wants to listen back for any more detail. Okay, great. Right, we're at 46 now. I'm not quite sure. Let's see how many folk we have back. Quite a few, so just give one more minute because we were very slightly 2 minutes late going into break. Verena, I just wondered if there's a time for the new update to the standards to be published from NICE, and if it would be possible to let people know that. Just we were all wondering at HEW, when will they hit the press?
Yeah, no, definitely. I have a timeline in, but we're gonna go out for consultation in April. It's planned for 12th of April. So, and I will make some advertisement for that because it will be really useful to get some feedback on the standards we are producing, and so we will kind of use this as some advertisement for that.
Absolutely. Okay, so it's now 14:47, so hopefully people have had a chance to take a short break and to rejoin us. So welcome back, everyone. Our next 30-minute session aims to take a bit of a deeper dive into developing methods to evaluate digital technologies. And this will be followed by an interactive session where we'll discuss in smaller groups applying the NICE evidence standards for digital technologies, but more on that in 30 minutes or so. So I think it's fair to say that the rapid growth in the use of digital technology and the unique features has resulted in the technology assessment methodologists like us at HEW and NICE running to keep up in terms of the pace of development. But the National Institute of Clinical Health and Clinical Excellence, otherwise known as NICE, has as always been at the forefront in the vanguard and has from 2019 produced an evidence standard framework for digital technologies to direct the efforts to assess them. And that's actually currently being refreshed at the moment and hopefully is going to be hot off the press very soon. So we're really delighted to welcome Verena Wolfram from the NICE Office for Digital Health, who's going to bring us up to speed on these developments and the current state of the art in the digital standards. And just a brief bio on Verena. So Verena has over 12 years of biomedical and pharmaceutical experience gained within healthcare consultancies and also as a researcher in academia. She's worked across a multitude of different therapeutic areas. She has a PhD in neuroscience from the University of Cambridge and an MSc in molecular biology from the University of Oulu in Finland. I'm not quite sure I pronounced it correctly, but I've done my best. So over to you, Verena, to bring us up to date on NICE developments in this fast-moving field. Thank you.
Okay, thank you, Susan, for the introduction. Yes, you did pronounce it very well, and that's in Finland, Oulu. So yeah, thank you very much for the invitation to present to you today on our evidence standard framework for digital and AI. And as speakers before me said, it's a very fast evolving field, and so it was quite timely for NICE to kind of step on it and produce this framework. So as Susan said, I'm working for the NICE Office for Digital Health, and my first slide is just going to give you a very brief introduction of what that is actually about. So it's a relatively young function within NICE, and it really came about sort of as a reaction to like the fast moving field, and it aims to accelerate NICE's activity in the digital health sector and to make digital health technology available to the NHS and its patients. And what we're trying to do is like really to manifest and apply the robust methods and processes that NICE is known for, but also implement some flexibility and agility to really mirror the digital health market, and to then fit into the broader political and national policy agendas for innovation in health and social care. So the Office for Digital Health is sort of an umbrella for all digital health related work stream within NICE. So it's like established to kind of bring all the work streams within NICE together that are interested in digital health, but also to be an external touch point for the sector. And so we are kind of also like trying to establish like big networks to collaborate with partners across the sector, and to provide clarity on regulation and commissioning. And I'm talking quite a bit, you will see like in my talk, I'm coming back to this network and collaboration quite a lot. So what I'm actually here today is really to tell you all about the NICE evidence standards framework. And as Sue said, this is not actually a very new development. So it was commissioned by NHS England in 2018, and it was published in 2019. And at that time, it was a lot smaller than we are doing at the moment. But it was supposed to be a trusted and respected set of standards that describes the evidence which is needed for the different health technologies that are likely to be commissioned by the NHS and in the care system. It was aimed at developers so that they can understand the level of evidence that is required and they would need to produce. And it was also aimed for commissioners to kind of understand what evidence should they be looking for. So I should say it's not a regulation, so it's not replacing a regulatory process, and it's also not replacing a NICE guidance. It was developed as sort of an addition, shall I say, to NICE guidance, because we at NICE are unable to really evaluate all the digital technologies that come on the market and that are likely to be commissioned by the NHS. So it's kind of really like a guide for local commissioners, that they know what to look at. So again, as Sue mentioned, we are currently updating the evidence standards framework, which we started last year, and we will be going into consultation with the latest draft in April. I think it's going to be the 12th of April as scheduled, and we're going to have, it's open for a 2-week consultation, where we hope like a lot of people who are here today will contribute to making the standards even better. And we're hoping to publish the standards by the end of June this year. So the goal really for the update was to align with the regulatory requirements. So the MHRA is at the moment also changing or amending their regulation for medical devices, including digital devices and AI. So we really want to be like closely matching what the MHRA is coming up to. We also hope to improve the functional classification of the framework, and we kind of try to react to some stakeholder feedback we gotten from version 1 and 2. And the second goal was really the expansion into AI and data-driven technology, which was purposefully omitted in the first round, because it was at that time felt that there wasn't that much information yet. And so here we really collaborated very closely with our academic partners at Imperial College, Birmingham, and the Alan Turing Institute to really think through, like, what is different in AI? What do we have to, what standards do we have to bring specifically for AI and data-driven technologies? And we also have worked with HTW and SHTG on these standards as well, and presented them to those groups. So what we changed, I just put this slide in case somebody has been familiar with the current evidence standard. So what we changed in the update is we changed something in the classification. like our Tier C, which is the highest risk class, which I'm going to come to in just about a slide. We align this to what's called the Imdrf classification. So that's the International Medical Device Regulators Forum. And we know that the MHRA regulation will be pretty much mirroring this Imdrf classification. We also streamlined our Tier B to simplify the classification, because we have heard that it was sometimes difficult to really decide in which of the classes technology might fall. And then, of course, we have worked very hard on the standards. We have removed some of the contextual questions, and that took us away from having 2 levels of standards to just 1 level of standards. We have completely restructured the standards and the evidence tables, and this hopefully now will be a lot easier to understand, because it's kind of following a product's life cycle. And for the AI, we have incorporated some AI specific standards. However, we didn't put it as an add-on for AI, but we incorporate them because it was felt throughout our whole collaboration and through this whole project that a lot of the AI specific standards are actually an expansion of our common standards anyway. So I should just also mention what is actually included into this evidence standards framework, because we're not just talking medical devices here. We're talking about a wide variety of technologies, and we are including clinician-facing software, but also patient-facing health and wellness apps. We are including technologies that do have measurable outcomes, so which are for treating, for example, for treating conditions, but we also including technologies that are targeted to system efficiencies and cost savings. And as in the first version, we including digital health technologies that are static, so that are not changing, and those that may change over time, like AI. And this is really reflected in this graph, or in this picture here. So we are aware that we cannot really ask the same standards for all those technologies. So we have made a risk classification, which depends on the intended use. And we have three tiers here: Tier A, Tier B, and Tier C. And these are ranked according to the risks they pose to an individual or to the healthcare system. So in Tier A, we have technologies that are intended to save costs or relay staff time, and that do not have very direct patient or healthcare outcomes. So these are really system services that provide services to the health and social care system. So this could be scheduling systems or routing systems. And then we have the Tier B, and the Tier B are technologies that help citizens and patients to manage their own health and wellness. So we have there 3 classes: communicating about health, health and care diaries, and promoting good health. And these are technologies that are not patient specific. So there are more of a population health technologies, which are not targeted for very specific conditions. In the communicating about health, we have technologies that allow a two-way communication between citizens, patients, or healthcare professionals. In the health and care diaries, we have lifestyle improvement apps for general health monitoring, and this could include fitness wearables and health diaries. And in the promoting good health, we have technologies that are on a population level promote information of healthy lifestyles and managing conditions. So those Tier B apps, those Tier B technologies, they are not medical devices. So they are outside of MHRA regulation. In Tier C, we do have the medical, so we feel like in Tier C, most of the technologies will likely to be medical devices. So not all, but most. And here we have 4 groups. We have the inform, the drive, the treat, and the diagnose ones. And they are really aligned to what's in the IMDRF, like the inform, where it does not trigger an immediate or near-term action. The drive is for like guiding diagnosis and treatment, and then we have the treat and diagnose ones. So these are the classification, and I think that's what will be discussed a bit later with the case studies as well. And this is just a slide, and probably you will be seeing those slides. They will be shared. So this is just like kind of an illustration of how we feel that the classes in the ESF are mapping to the IMDRF or MHRA classes, but this is still work in progress, and that's like kind of our first take on how it should look, and that's for the Tier C technologies. And you can see that, like for example, in the inform, we anticipate that we have class 2A and class 1 technologies, and similarly in the treat, we may have class 2A, B, and 3 technology. So it's not a direct mapping, but it kind of gives an indication of what we're looking for. And then this was the classification. And then, of course, we had to kind of look for the evidence standards. And we had like kind of really had to find a balance between setting, the evidence standards not too high to create a barrier, but setting them high enough so that it really helps to ensure effectiveness. And then also we, didn't want to be too technical so that they can't be understood, but we still have to be quite technical so that to allow for precision. So we had to kind of find a balance between those things. And we came up at the moment with 24 standards, and we have like grouped them into 5 groups. As I said, we are hoping to reflect the life cycle of the technologies. So looking at design factors, then describing value, demonstrating performance, delivering value, and then also deployment considerations. And we felt that all 5 of these are quite important for digital technologies, because like answering those standards will really facilitate adoption and deployment in the NHS. And unfortunately, I don't really have time to go like over all of those standards in detail. But I think previously, like standards we have now included are, for example, environmental sustainability standards. Also the professional oversight we have included. I'm just gonna jump like maybe 2 slides further, where we just illustrate like what are new standards and what are standards where we included things that are more relevant to AI and data-driven technology. So you see here that most standards are, well, all standards are relevant for all technologies, but some standards have like elements which are AI specific. And then we have incorporated some new standards which we feel like answers some of the NHS concerns as well. For example, the environmental sustainability, which we have worked really closely with Greener NHS to at least get the gist of what we can be asking there. And so this is quite a big set of standards, but we also have been thinking, I just would like to mention that here, have been thinking of technologies that are a bit earlier in development, so that may not be able to fulfill like all those standards, but particularly the demonstrating performance standards. And NICE just has put like one of its priorities out to think about contingent approval in the next few months. So we are hoping to kind of support this idea here as well. So these would be evidence standards for an early deployment, so for DHTs that are still in the evidence generation or in early access programs. And here we kind of suggest a bit of a smaller standard frame, taking some of the performance standard and delivering value standards out, and just like using pretty much the same framework, but highlighting that the concerns that some of those standards will not be fulfilled for technologies very early who are just going into evidence generation. And those are just the timelines to say again that we're going to go out for public consultation and for publication in April and June this year. So, sorry, that was quite a quick
No, thank you so much, Fiona. We really appreciate it. And do keep in mind, people, if you've got contributions to add to the public consultation, then please do get in touch. It was helpful to have that update. We're going to move swiftly on to our next speaker, David Jerome. So David is the Principal Health Service Researcher for Health Technology Wales. He joined HDW almost at the beginning in February 2018 and is responsible for heading up our organisation's horizon scanning function, as well as our methodological developments. He has a PhD in biomedical sciences and has spent the last 10 years working in evidence-based medicine and HTA for both Welsh and UK organisations, including Nhs and the All Wales Medicines Strategy Group. So David, I'm going to pass over to you. You're going to take us through a bit of an overview of our topic referral and selection processes in anticipation of our summer digital topic call. So start thinking about what you'd like to send to us to consider for appraisal. And David, if you could catch us up a few minutes, then that would be fantastic. Okay, I think we're just waiting to see your slides, David.
Thanks so much. Have my slides loaded?
No, not yet. Maybe the connection is slow your end. I don't know, Priya, would you be able to load? Ah, there we go.
Have you got them now?
We do, thank you.
Okay, great. Sorry. Apologies, as I say. Always seems to be a challenge that. So thank you, Verena and Peter have probably done a lot of good work here in introducing things that I'm going to build upon, really talking about, you know, Peter's given you a good overview of HDW and what we do and how we assess technologies in general. And Verena's given you just a very quick run through of the evidence standards. I'm going to talk about how we evaluate digital, how we have used the standards and how we're going to use those in the future. And as Susan has said, hopefully just a few minutes. So yeah, you've heard from Peter already about sort of our different areas, and really I'm going to talk about sort of identification and appraisal. Adoption is kind of an open question and something we probably need to come back to in the future, but really how can we use, at the moment our focus is really on how we can use, how we can identify digital technologies, and how, when we appraise those, what specific issues do we need to take into account. So this is just a quick reminder and a plug. Anyone can suggest a topic to us at any time on anything that's not a medicine, and we, as we have probably rammed home, have an open topic call coming up on digital in the summer. So this is all really timely stuff to consider the things I'm going to talk about. And when we do get topics in, these are some of the criteria that we take into account. And I'm going to come back to this slide, so I'm not going to talk about it in great detail here, but it's about asking questions around, is there the right sort of evidence for us to conduct an appraisal? What would the benefit of that appraisal be? Is the technology likely to deliver benefit? Are we getting feedback from stakeholders in health and care? There's a lot of variation in how a technology is used and any advice around that. Is there potential for things like quality improvement? Like I say, general themes there. I'm going to come back to this slide, so I appreciate I'm whizzing over that. And I think Peter touched on this, but for technologies that are referred to as, which we refer to as topics, we produce a couple of main types of outputs. We produce something called topic exploration reports. Now, as I think there was a slide of Peter saying, we produce something like 150 of these, and typically sort of 50 a year. And these are just a quick overview of the effectiveness of a health technology. It's kind of gap analysis level look at the evidence, you know, what do we know and what don't we know? And this is just a relatively old example now, actually, of Parkinson's kinetograph, which is some wearable tech, actually, for people with Parkinson's disease. And yeah, this is just another example, another digital example that's something that's a storage system for patient data. For a smaller proportion of things, we produce guidance, which is designed to provide simple but detailed advice on the use of a technology that's designed to be adopted by the whole of NHS Wales, and, you know, give once for Wales advice. This is backed up by rigorous, well, evidence review I've written there, but review of the clinical effectiveness and cost effectiveness, but also other aspects like how does it influence patients, and particularly important with digital, what are the practical and implementation issues around deploying that technology into the health and care system in Wales. And yeah, so on the left is our advice for Freestyle Libre, which is sort of our guidance, which is a 3 or 4 page document, but backed up by a 100-page report, which aims to go through all the detail of and the issues I've just described around clinical effectiveness, cost effectiveness, and all the associated issues. So how then can we use the, we're going to come back to the evidence standards now that Vereena's talked about. How can we use these to identify and appraise digital health technologies? And then I'm going to talk a little bit about how we have used these, and how I think we're going to use these in the future, particularly with the update that's coming to these. So for quite some time now, we've used the categorization system that the evidence standards provides to categorize and classify digital health technologies. We then use this to assess their suitability to go through our appraisal processes, and crucially also, as a big part of that, assess what evidence should be taken into account in that assessment. And I'll just spend a little bit of time now talking through some examples of how we do that. So as Vereena said, the first version of the standards came out in 2019, and we've used them pretty much since the outset. In the summer of 2019, with Digital Health Ecosystem Wales, we held a workshop face-to-face in the Life Sciences Hub, which seems a very different thing to do now. But yeah, on were these fit for adoption in Wales, and if so, how they should be implemented. And actually, some of the feedback we got then was, yeah, they're completely fit for purpose, and why reinvent the wheel around things like the evidence classifications and so on. A lot of the issues that were raised were from colleagues in what was NWIS then, but now is Digital Health and Care Wales, around implementation and adoption and making sure there's some guidance on there. And that's why I really welcome the changes that are coming in the evidence standards to provide a little bit more steer on this. Off the back of this, we started using the classifications in the evidence standards frameworks in all our topic exploration reports, where we look at anything that we can classify as a digital health technology. And within that, we include basic statements on what evidence is expected for those types of digital health technologies for the classification that they fall into. And then that provides us then with a steer on whether, well, okay, this is the evidence we expect to see. Does that evidence exist? If it does not, then obviously that's a fairly clear signal that this is probably not something that's the right time for us to appraise. And hopefully that's also feedback to our stakeholders, whether that's commissioners or whether that's the developer or people interested in the technology, about where more research might need to be done. And like I say, and hopefully that feeds into sort of hopefully that feeds into, you know, kind of taking an approach to the whole life cycle of a product, because then that may generate more evidence, in which case we can come back and look at this at a later date. So yeah, just to return to this slide then, and think about some of the ways we use we use the evidence standards, and I've updated this because this is quite an old slide, and I've tried to put in some things about how I think we're going to use this with the new standards. So for the first question, with things around are there likely to be sufficient, is there likely to be sufficient evidence on which we could do an appraisal, do a technical.
Hi David, sorry to interject. We're having some sound quality issues. I wonder if it might be easier if you...
Well, I'll use the classification to do that.
Hi David, I wonder if you could perhaps halt your video because we're having some break-up in the sound.
Okay.
I think the slides might be behind as well.
There we go. Apologies. I will do my best.
That's better, thanks.
Okay, I'm nearly done, so apologies. So you should have the slide with the criteria for potential topics in front of you. Yeah, and so yeah, there's various ways we can use these. There's in terms of looking at what sort of evidence we need and whether that's the right sort of evidence. We've used the classification system in this, and then we've used what were called the evidence for effectiveness tables, but are now the 24 standards that Vereen has briefly showed you. And then the same kind of things for, is there likely to be clear additional health benefit? The second question, obviously that depends by and large on the evidence, and we'd look at particular aspects of the standards around that, such as the design value and performance standards. Skimming over this, then obviously is the technology likely to have an impact on resources? Well, there's now clear things around what were the economic standards, but are now called the value standards. And as I say, I think the part of this was particularly new and useful is what's likely to be the major impact in terms of things like deployment and implementation. And again, I think what are now called the value and deployment standards provide really useful steer on that we can hopefully use in our appraisals. And yeah, just to return to this slide, I mean, like I say, I think for us to reflect on this, you know, I think when we set out on this, we were like, okay, there's a toolbox we need to use to appraise digital in the same way as a toolbox of lots of different things you need to use to appraise, to do health technology appraisal in general. I think returning to this slide, which I made some time ago, I'd say the digital standards is a tool we reach for an awful lot, and probably one of the ones that would end up towards the top of my toolbox. I think it's definitely fair to say, and I hope that's something that will continue in the future. So yeah, just to wrap up then, so just thinking about the future, obviously there's big changes to the ASF coming, and so we need to adapt our processes to make use of the new ASF when that's published, and we've been working with NICE in collaboration, as Verena said, on you know, going through the iterations and developing that. Obviously we have the digital call coming up, and we have the pre-consultation version now, which we're working with our task and finish group, and hopefully when the published version will be in time to use the ASF to guide our topic selection processes, and then embed that into our business as usual processes afterwards, because of course we won't just be considering digital within the topic call, we'll be considering a steady stream of digital technologies in the future as well. I hope, moving on to sort of appraisal, that the framework, the 24 questions, now gives us some steer we can use with developers and other stakeholders on what needs to be done differently around appraising different digital health technologies, getting some of the answers to those questions and feed those into our appraisals, and then updating all our process and documentation to incorporate, and like with everything, to try and do so transparently. And I think that is everything from me. Oh yeah, and just two more plugs to say, yes, as Verena said, please, you know, do feed into the consultation, and like I say, in the summer, then please start thinking about things to suggest to us as part of our digital call. And I will wrap up there. And apologies for the inevitable internet quality issues.
No, I think we managed to get through it, so thank you, David. Just to say thanks both to Verena and David for setting the scene and outlining the developing methods and standards to assess the value that digital technologies offer to our care systems. We're now going to move into a more interactive session that will be facilitated by the HEW researchers, and the aim of this session is really to bring the standards and the utility to life by considering some examples of digital tech that HEW has appraised and produced national guidance on. So each group will be given brief vignettes of example technologies, and we'll work together to classify them using the existing evidence standard framework. You'll be randomly allocated now into a smaller group of perhaps around 10 with an assigned HEW researcher who will facilitate. There may be a 10 or 15-second time delay before you enter your discussion room, but please bear with us. You should hopefully follow on quite quickly. We've allocated 30 minutes. A flag will appear when 10 minutes and 5 minutes remain within the discussion section, and then you'll receive a 10-second warning that you're being transferred back to the main event room at around 15:45. So I hope that's pretty clear. So Priya will now do the magic in the background and allocate you randomly into a discussion group. Thank you so much, enjoy your discussions, and see you back here at 15:45. Okay, welcome back everybody. Hopefully you've been reallocated back into the main event room. So thank you so much to all of the HEW facilitators for taking us through that. Certainly in my group there was very enthusiastic participation, and we scored 4 out of 6, which we thought 66% wasn't too bad. We should get at least a silver star. But the first 2 were tricky, so we learned as we went, and hopefully that will be your experience when you come across the digital standards in the future. So thank you very much for going through that exercise. The NICE framework that we've just been discussing has received much international attention, and it's been used by technology assessment bodies across the world. So adoption of that, if you like, set of principles within Wales really places us at the forefront of thinking and methods under review. And as Verena has already said, if you've got any thoughts or feedback you'd like to offer based on the discussions we've just had, then please do input to the public consultation, which launches on the 12th of April. So we're going to move into the final phase of our agenda this afternoon. We're nearly there, final furlong. Next up, we have a brief presentation by Lauren Elston. So Lauren is one of the HEW senior researchers, and she co-leads the work on our digital strand with David Jerome. So Lauren, after completing her PhD in cancer immunology, she joined the All Wales Therapeutics and Toxicology Centre as a medical writer, and she's worked in the field of health technology assessment in medicines and non-medicines for a number of years now. She's really passionate about writing, clearly writing and disseminating HEW's work, and she also has qualifications in biology, a BSc in biology and an MSc in biomedicine. And she's going to take us through a case study of an example that came through HEW's doors, a little bit more detail on the Freestyle Libre device, which monitors blood glucose that Peter touched on in his welcome opening session. So over to you, Lauren. Thank you so much.
Thanks, Susan.
If we could just put all mics on mute, thank you.
Okay, so this is just going to be a brief whirlwind tour through one of our examples of digital technologies that we've looked at to date. So Peter mentioned earlier that during the past 12 months, we've considered 12 technologies that are within our remit and suitable for topic exploration. 2 have progressed to our evidence reports and guidance. One of them is published, and that's the Freestyle Libre. And then there's 1 in progress, which is electronic blood management systems. And I'm going to touch on that one a bit more tomorrow instead. So the topic that we're looking at is the Freestyle Libre for the management of diabetes. Many people with diabetes have to regularly measure their blood glucose throughout the day to help inform management of their condition. The main approach to this is the self-monitoring approach, so the finger prick testing. And Freestyle Libre is a flash glucose monitoring system that is to be used by people with diabetes to monitor their glucose levels. It includes a body sensor, which is inserted under the arm. That's the circular thing that you can see in the picture. And then there's an app that can be used to read and restore the results. And the body sensor can last up to 14 days on the arm there. We actually originally issued guidance for this first time round in November 2018, and our guidance is periodically updated when and where necessary. And in this case, following stakeholder consultation, we decided to reappraise this topic and publish the updated guidance. And that was because since the original 2018 guidance had been published, there had been a substantial change in the available evidence. So what we did was that we reviewed the relevant new primary and secondary evidence that was published since that guidance, or since the report that informed that guidance. And we also produced additional de novo analyses in both the clinical and the cost effectiveness. I'm going to briefly touch on our appraisal process. It's been touched on throughout the day, but I'm aware that not everyone is familiar. This is a very high level overview of some of the key steps in our appraisal process and who's involved in them. So there's the initial topic identification. That's where things come through the suggested topic on our website, or Health Tech Connect, which David's going to talk more about tomorrow. That's where manufacturers or innovators can put their medtech onto the database that is then picked up by accessors for that database. And it's also our topic calls, like the digital topic call. Again, we're going to touch on that at the end of the day. This can either come from the topic proposer or through the HDW team, and then we look at it and make sure it's in our remit. If it is in our remit, we will undergo topic exploration and prioritization, and that involves the topic exploration report. You'll have seen from David's presentation, there was an example there. It's a high-level overview search of the available evidence and any gaps that there might be, whether or not there's enough to reasonably undertake an appraisal. And if it goes on to the appraisal programme, then we develop a protocol, which is essentially the criteria of what we're looking for, the research question that we're aiming to address. That's undertaken by the team, but we also get input from the topic proposer and experts if needed. And then we also have the evidence review and consultation. So that's the big evidence report that David touched on. So the Freestyle Libre one was about 100 pages long. And again, this has a consultation where we send it out to experts for their input and ask them questions about the appropriateness and the methodology, and if anything is missing that should be taken into account, that kind of thing. Once the evidence review is finalised, it's appraised by our appraisal panel, and they produce guidance on whether or not a technology should be adopted. And then there is also, obviously our guidance is published, disseminated to appropriate parties, and it has the tagline of adopt or justify for Nhs Wales. So that's that it should be adopted or justified, why not? So it's worth emphasising that we do include our stakeholders and involve our stakeholders in various steps and various different stakeholders throughout the process. So this one was a bit interesting because it's a reassessment. So we had stakeholders involved in the reassessment considerations and the protocol updates. During the consultation, like I said, we have experts commenting on the report and giving feedback, and for Freestyle Libre that included national clinical leads for diabetes and consultants and nurses in diabetology, as well as manufacturers. And then also something that I haven't mentioned but is really worth emphasising is that we at HDW, we aim to capture the patient or citizen perspectives, and we have our patient and public involvement standing group, and they determine a mechanism for each of our appraisals, like what mechanism is appropriate to gain that perspective. So in this case, we had a summary of some of the patient literature, but we also sought input from Diabetes Cymru, who helped us with a patient submission. And then that was also included and presented at the appraisal panel for consideration as part of the guidance production. And this is what the updated guidance looked like. So you can see that we supported the routine adoption of Freestyle Libre because it was determined to be clinically and cost effective. Peter went into more detail in this at the start of the day, so I'm not going to go over it again now, but a very positive outcome. And I also just wanted to finish on a bit of a high note with how our stakeholders found the process, but and the impact that it makes. So I've emphasised a little bit of each of these quotes. The Joshua James quote, who's from Diabetes Cymru, is Policy and Public Affairs Manager. He said that the outcome of the review is a step forward in helping people across Wales to access the right technology to help them live better, happier lives with all types of diabetes. And then Sam Howard from Abbott Diabetes Care. It's quite a long quote, very positive, but at the end I thought it was worth emphasising the use of the real world evidence demonstrating the value in addition to the randomised controlled trials. So demonstrating the value in clinical practice rather than just in the clinical trial setting, which I think feeds a lot into some of the things that we've been talking about today, and with the evidence standard framework, how it's depending on the tier, real world data, real world evidence, especially for digital technologies, can be very important in helping to give an idea of the effectiveness of that, or the value of that technology in Wales. So that's where I'm going to finish there.
Okay, thank you, Lauren, particularly for catching us up on a few minutes to keep us to time, which is excellent. Great to have a case study just to outline some of the things that we've been discussing this afternoon. So amazingly, we're near the end of our first afternoon session. Not everybody can join us for the second session tomorrow. So we just wanted to round off the day by taking a few brief minutes for HDW and Life Science Hub Wales colleagues to briefly outline the next steps in our efforts to collaborate and align our respective efforts to bring forward the digital technologies that offer the most promise and value to the people of Wales as quickly as possible. And I've introduced Lauren already, but I think firstly we'll turn to Delith, who's going to give us a bit of next steps from Life Sciences Hub point of view. So Delith James is the Programme Manager for Life Sciences Hub Wales. She's responsible for the delivery of the Digital Health Ecosystem Wales, which brings together industry clinicians, policymakers, academics, innovators and funders with the aim to accelerate the adoption of digital healthcare technology in Wales. She has 20 years of experience as a service delivery and contracts manager and started her career in information management within NHS Wales. So I'm going to pass over to Della just to think a little bit about next steps in a few moments, and then we'll hand over to Lauren. Thank you. Oh, just to say you're on mute, Dallas.
Fab, thank you. Thanks so much. I mean, this afternoon's event has been absolutely fantastic, and I think everybody's had a huge amount of information given to them. So I'm just literally going to spend a couple of minutes talking about the Life Sciences Hub, and in particular the work that I'm involved with the digital health ecosystem in Wales. I don't know if everybody's familiar with the Life Sciences Hub, but just to let you know, it's an arm's length body of Welsh Government, and we, as Susan mentioned, we support the delivery of innovation in health and social care in Wales by connecting industry, health, social care and academia. And how we actually do this, I'm going to come on into it in 1 second. So we do have a digital team at the Hub, and we offer support across the evaluation and adoption of digital technology into health and social care. We engage with health and social care organisations across Wales to prioritise the challenges that they face and offer support on how digital technology can help them with sustainable solutions around their challenges. So our team carry out horizon scanning for tech solutions, and we develop industry challenges on behalf of our partners, and also provide project management support for the evaluation and adoption of digital technology. And all of this is supported by our digital health ecosystem in Wales and the wider innovation landscape. So the Digital Health Ecosystem in Wales is a life sciences hub-led programme, and that brings everyone together to create that environment of digital innovation in a Welsh health and social care setting. And we work with national and international networks to share examples of our good practice, but also to learn from others as well. And so we bring together people through regular targeted events such as this one today. And I'd encourage you all to sign up to our newsletter that will keep you up to date on all our planned events. We do have a few planned coming up around the funding landscape for digital technologies in Wales, digital and AI in the cancer pathway, and also a workshop on our cardiac remote monitoring project that we have ongoing. So if you've got any interest at all in those particular areas, it would be absolutely fantastic if you attended those events. Our newsletter, it also shines a spotlight on some of our industry stakeholders and gives you some examples of the technologies that are available. And you can also keep up to date on the projects that we are working with, a couple of which Healthy.io and Pain Check will be talking about in further detail tomorrow, and they're really exciting projects. It's easy to sign up for our newsletter, so I am going to do a shameless plug for it now. You'll find a link on our website, and also I'd urge you to check out the digitalhealth.wales website. And so not only can you find out more information about our ecosystem and sign up for that newsletter, but you'll also find out further information about other digital programmes in Wales, such as Tech Cymru and the National Data Resource. And there's also a link on there around a range of Care Home Cymru resources, and that aims to help people working in health and social care as well. And then finally, another way that we bring people together is that we also facilitate an AI special interest group for clinicians, health managers and academics in Wales. And we hold monthly online meetings. It's roughly an hour every month. And that's got an aim of sharing best practice and learning more about the opportunities that there might be for collaborative working, funding opportunities, and we also invite industry along to those meetings as well to talk about their work. And alongside that membership group, we also have an online platform for group members to join and engage with each other in between meetings. So there's lots of content that you can engage with. So if any of you or your colleagues are interested in joining our AI special interest group, then please do contact me for more information. And we're going to be sharing some contact details at the end. So please do make a note and get in touch, because we'd absolutely love to hear from you and get you involved in our ecosystem. So a couple of shameless plugs there at the end as well. So that's it from me.
Thank you, Delith, so much. So Lauren, would you like to just outline some brief next steps for HEW, please?
Yeah.